Assessing the skull and face, eye structure and visual acuity, ears and hearing, nose and sinuses, mouth and oropharynx, and neck. First is to assess the skull and facial feature. Assessing the skull and face is an inspection and palpation of the skull and face, and also measuring the skull circumference, in which the presence of deviation and changes of facial shape may indicate a disorder or certain condition. First, inquire if the client has any history of the following: lumps or bumps, itching, scaling or dandruff, loss of consciousness, dizziness, seizure, headache, facial pain or injury. Good day, ma'am. I am Hazel, your student nurse for today. And now, I will going to assess your facial feature and skull. But first, I need to verify if you have any lumps or bumps, scaling, or dandruff.
No.
Do you also experience loss of consciousness,
No.
dizziness,
No.
seizure, facial pain, or injury? Okay, thank you, ma'am. If the client experienced those, ascertain the following: when and how any lumps occurred, length of time, any other problem existed, any known cause of any problem, associated symptoms, treatment, and recurrence. Before doing the procedure we need to do the gloving for us to prevent any acquiring of infections, and also or hand washing to avoid cross-contamination among the clients. After doing the gloving is inspect the skull for size, shape, and symmetry using measuring tape for the size. Palpate the skull for nodules or masses and depression. Use a gentle rotating motion with the fingertips. Begin at the front and palpate down the midline. Then palpate each side of the head. Use this. Then, inspect the facial features. Then, inspect the eyes for edema and hollowness. Note symmetry of facial movements. Ask the client to elevate the eyebrows, frown or lower the eyebrows, close the eyes tightly, puff the cheeks, and smile and show teeth. Ma'am, can you elevate your eyebrows? Can you lower it down? Can you close your eyes tightly? Can you puff your cheek? Can you smile and show your teeth? Okay, thank you, ma'am. Then, document findings in the client record. Assessing the eye structure and visual acuity. Assessing the eye structure and visual acuity is an examination of the eye that includes the external eye structure, visual perception, ocular movement, and visual fields. Assessment of vision provides important information about clients' ability to interact with environment and perform activities of daily living. Inquire if the client has any of the following: family history of diabetes, hypertension, or blood dyscrasia, eyes disease, injury or surgery, last visit to an ophthalmologist, current use of eye medication, uses of contact lens or eyeglasses, hygienic practice for curative lenses, current symptoms of eye problem. Do you have any of those, ma'am? Okay, thank you. After taking the health history of the client, we will now assess the external eye structure. Inspect the eyebrows for hair distribution and alignment and for skin quality and movement. Inspect the eyelashes for evenness of distribution and direction of curve. Inspect the eyelids for surface characteristics, position in relation to the cornea, ability to blink and frequency of blinking. Inspect the lower lids where the client's eyes are closed. Then, inspect the bulbar conjunctiva for color, texture, and presence of lesions. Inspect the palpebral conjunctiva by everting the lids. Evert the upper lids if a problem is suspected. Ask the client to look down while keeping the eyelids slightly open. Gently grasp the client's eyeglass with thumb and forefinger. Pull lashes gently downward while holding the eyelashes. Hold the margin of the everted lid or eyelashes against the ridge of the upper bony orbit with the applicator stick or your thumb. Inspect the conjunctiva for color, texture, lesion, and foreign bodies. Inspect and palpate the lacrimal gland. Use the tip of your index finger. Palpate the lacrimal gland. Observe for edema between the lower lid and the nose. Then, inspect and palpate the lacrimal sac and nasolacrimal duct. Observe for evidence of increased tearing. Using the tip of your index finger, palpate inside the lower orbital rim near the inner canthus. Then, we'll now proceed to inspect the cornea for clarity and texture. Ask the client to look straight ahead. Hold a pin light of an oblique angle to the eye and move the light slowly across to the corneal surface. Then, perform the corneal sensitivity test to determine the function of the fifth cranial nerve. Ask the client to keep both eyes open and look straight ahead. Then approach from behind and beside the client and lightly touch the cornea with the corner of the gauze. Then, inspect the anterior chamber for transparency and depth. Use the same oblique lighting used when testing the cornea. Inspect the pupils for color, shape, and symmetry of size. Assess each pupil direct and consensual reaction to light in a partially darkened room. Ask the client to straight ahead using a pen light and approaching from the side. Shine a light on the pupil. Then observe the response. Then shine the light on the pupil again and observe the response of other pupil. Assess each pupil reactions to accommodation. Hold an object about 10 cm from the client's nose. Ask the client to look first at the top of the object, then at the distant object behind the pen light. Alternate the gaze between the near and far object. Then observe the pupil response. Next is move the pen light or pen towards the client nose. The pupil should converge. To record normal assessment of the pupil, use abbreviation PERLA. Now, we will going to assess the client's visual fields. Assess peripheral visual fields. Have the client sit directly facing you at a distance of 60 to 90 cm. Ask the client to cover right eye with card and look directly at your nose. Cover or close your eye directly opposite the client's covered eye and look directly at the client's nose. Hold an object in your finger. Extend your arm and move the object into the visual field from various points in the periphery. Ask the client to tell you when the moving object is first spotted. To test the temporal field of the left eye, extend and move your right arm in from the client's right periphery. To test the upward field of the left eye, extend and move the right arm down from the upward periphery. To test the forward field of the left eye, extend and move the right arm up from the lower periphery. To test the nasal field of the left eye, extend and move your left arm in from the periphery. Then repeat above step for the right eye. Okay, ma'am. Did you see the moving object? Okay, thank you. Proceed to the extraocular muscle test. Assist 6 ocular movements to determine eye alignment and coordination. Stand directly in front of client and hold the pen light at a comfortable distance such as 30 cm in front of the client. Ask the client to hold the head in a fixed position facing you and follow the movements of the pen light with the eyes only. Move the pen light in a slow, orderly manner through the 6 cardinal fields of gaze. Stop the movement of the pen light periodically so that nystagmus can be detected. Assist for location of light reflex by shining a pin light on the pupil in corneal surface. Have the client fix it on a near or far object, cover one eye and observe for movement in the uncovered eye. To complete the assessment for the eyes, we need to assess visual acuity. Assess near vision by providing adequate lining and asking the client to read from magazine or newspaper. Assess distance vision by asking the client to wear corrective lenses unless they are used for reading only. Ask the client to sit or stand 6 meters from sneering chart. Cover the eye not being tested and identify the letters or characters. Take 3 readings, right eye, left eye, and both eyes. Perform the functional vision test if the client is unable to see the top line, 20/200 of Snellen chart. B. L. Ano na? C. Then, documents the findings of the client in the client's record. Assessing the ears and hearing. First is you need to assemble equipment. You need to prepare otoscope with several size or ear specula. Assuming that this is our otoscope. First is inquire if the client has any history of the following. Family history of hearing problems or loss. Presence of any ear problems. Medication history. Any hearing difficulty. Use of corrective hearing devices when and from it was obtained. Then, position the client comfortably seated if possible. Then, inspecting the auricles. Inspecting the auricles. Inspect the auricles for color, symmetry of size, and position. To inspect position, note the level at which the superior aspect of the auricle attached to the head with relation to the eye. Then, palpate the auricle for texture, elasticity, and areas of tenderness. Gently pull the auricle upward, downward, and backward. Fold the pinna forward, and it should be coiled. And use this. Then, push in on the tragus. Then, apply pressure to the mastoid process. In performing the external ear canal and tympanic membrane, you need to wear gloves. In performing the external ear canal and tympanic membrane, using an otoscope, inspect the external ear canal for cerumen, skin lesions, pus, and blood. Attach a speculum to the otoscope. Tip the client's head away from you and strengthen the ear canal. Hold the otoscope either right side up with your fingers between the otoscope handle and the client's head, or upside down with your fingers and the ulnar surface of your hands against the client's head. Then, gently insert the tip of the otoscope into the ear canal, avoiding pressure by the speculum against either side of the ear canal. Inspect the tympanic membrane for color and close. Avoiding pressure. Gross hearing acuity test. Assess the client's response to normal voice tone. If the client has difficulty hearing the normal voice, proceed with the following test. Then perform the watch tick test. Now, we're going to perform the watch tick test. Assuming that I am using a digital watch with second hand. Perform the watch stick test. In performing this is we need to check the two ears. Then have the clients occlude the one ear out of the client side. Place ticking watch 1 to 2 inches from the unoccluded ear. Then ask what the client can hear. Then we will going to first the farther side. We will include the farther side and put the watch in 2 to 3, 1 to 2 inches. Then we need to repeat the steps. Then we need to occlude the other and put the watch. If you will perform the watch, practice is make sure that the environment is not noisy. Then, perform the tuning fork test. Assuming that this is the tuning fork. Perform Weber test. Tuning fork test. Hold the tuning fork at its base. Activate it by tapping the fork gently against the back of your hand near the knuckles or by stroking the fork between your thumbs and index finger. Then after, place the base of the vibrating fork on the top of the client's head and ask whether the client hears the noise. Conducting REN test. Ask the client to block the hearing in one ear intimately by moving a fingertip in and out of the ear canal. Can you read, ma'am? In and out of the ear canal. Then, hold the handle of the activated tuning fork on the mastoid process of one ear until the client states that the vibration can no longer be heard. Then, immediately hold still the vibrating fork prongs in front of the client's ear canal. If necessary, push aside the client hair if it hinders the tuning fork. Then ask whether the client hears the sound. Then documents the findings in the client's record.